I've painted the doom and gloom picture of living alone. So if you live alone, is there anything you can do about it? Fortunately, or unfortunately, depending on your outlook, there is. Find a roommate. Now, this is probably the hardest recommendation I give patients when I'm administering HealthScore. So many of my patients are so happy to be living alone and not sharing an apartment with roommates in San Francisco. Living alone in San Francisco with a rent as high as it is considered a coveted luxury. Most people I know who live alone in San Francisco prefer to keep it that way. But although there may be many advantages to living alone, improved health, unfortunately, is not one of them. So if you do live alone, I do recommend you find a roommate. But let's talk about that group of people who can't attribute their living alone to current circumstances or stage of life, but who are living alone because they have a preference for social isolation. What can be done in this situation? The most effective approach for people who live alone or are socially isolated is to address maladaptive social cognition. The way to do this is through cognitive behavioral therapy. The theory is that the problem is our negative beliefs and predictions. So we don't connect with others. We don't find long-term living partners because of what we think that will mean for ourselves, because of our aversion to the potential for loss or the potential for rejection. It isn't that we just haven't found the right person or circumstances can explain it. It's that we have beliefs and predictions that cause us not to want it. And in the hands of a skilled therapist, you would identify automatic thoughts that come to mind, automatic predictions that come out when you are in social interactions. So when you're talking to your boss, and what are your automatic predictions about what's going through their head? They don't think I'm qualified for a promotion. Or what are my predictions if I ask someone out on a date? Oh, I'm not attractive. They're not going to want to go out with me. So what you do is you just go over interactions with a therapist and describe what automatically comes to mind in social situations. So first you identify those beliefs and predictions. Once articulated, you can then test them. So inevitably, if you have developed automatic negative beliefs and predictions, you're going to be avoiding a lot of interactions where you're going to be at risk for experiencing what you predict will happen. So you avoid those social interactions. But instead, in therapy, you actually venture to challenge those beliefs and predictions. So you ask your boss for a raise, or you ask that person on a date, and you remember what your assumption and negative belief was, but you don't let it imprison you or prevent you from attempting to connect. And then you use the real life data that comes back, the responses you get from people in real life, to challenge your negative beliefs and predictions. So if you end up getting that raise, if one person out of 10 says yes to your overture for a date, that's information that no, you're not unlovable. No, your boss doesn't think you're incompetent. And allowing yourself to be open to challenge those negative beliefs eventually will lead to a more accurate picture of the world and the potential for social connection. This will also lead to an enhanced sense of personal control. So rather than thinking the world has written you off, you are lonely because you are undesirable to others, you can feel that actually you are lonely because you have been under the assumption that any attempt to reach out to someone else will lead to rejection. And so it was your beliefs that caused the state you're in rather than any objective quality that you possess that makes you unlovable to others. So if you are interested in this theory and this approach, I recommend you find a therapist who specializes in cognitive behavioral therapy. First step I recommend is go to your health insurance website. You can find a provider that's in your network. You can also check out this list of therapists reviewed by my patients. I constantly update this when any patient tells me they're seeing a therapist. It shows a review of the therapist and can be helpful if you're looking for someone. These are therapists who are seeing patients in San Francisco, but all of them have switched to telehealth since shelter in place, so you can avail yourself of their services even if you don't live locally.